Hi, welcome to the October update in therapeutics. In the next few minutes, I'll be looking at alerts from MHRA, to new guidance from NICE on adrenal insufficiency, and touching on some work by AWTTC on penicillin allergy delabelling. So first is an alert from MHRA on topical corticosteroids. This is an update of an alert in 2021 where because there's still been reports of important withdrawal reactions. And this is where patients are describing intense redness, burning and stinging, which can extend beyond the area of treatment when the medicine's been discontinued. It's most commonly seen in people who are using moderate to high potency steroids, and particularly in eczema and for long duration, so more than 6 months. So the reminder is to be clear about the strength of corticosteroid and the site that people are using it. And MHRA have now strengthened the labelling of the steroid so that it's easier for prescribers and patients to know what strength and potency they're being prescribed. And alongside that, there's a patient information leaflet that you can access, and we'll put that in the summary of the webinar afterwards. So next is an alert on topiramate, which is used in epilepsy and the prophylaxis of migraine. So similar to valproate, the advice is that it should not be used in pregnancy because of the increased risks of congenital malformation, low birth weight, and neurological problems. So it shouldn't be used in women of childbearing potential unless the conditions of the pregnancy prevention programme have been fulfilled. Women should use contraception at all times during treatment with topiramate and for at least 4 weeks after the last dose. And the final alert from MHRA is about the use of valproate in men. This is a precautionary advice due to small increased risk of neurodevelopmental problems. So the advice is for men treated with valproate to use effective contraception in addition to the contraception used by their partner. So this is while they're on treatment and for 3 months after stopping treatment. Moving on now to new guideline by NICE, new topic on adrenal insufficiency, and there's an associated 14-minute podcast. As you know, adrenal insufficiency is more common in people who've taken steroids by any route for more than 4 weeks and recently stopped, and we're always obviously very careful in our titrating down, but also people on steroids and who at a time of physiological stress. And the other group where adrenal insufficiency is more common is people taking opioids. So we're advised to consider adrenal insufficiency in people with unexplained hyperpigmentation, and then one or more of quite a long list of symptoms, but quite common things. So in adults, weight loss, salt craving, nausea and vomiting, loss of appetite, diarrhea, dizziness, low sodium and high potassium, lethargy, and a feeling of muscle weakness. So just a reminder there, and I just suggest if you're interested, do have a look at that guideline and at the podcast. So in July, AWTTC published guidance on penicillin allergy delabelling in adults in hospitals. And as you probably know, this is really important because about 10% of the population are labelled as allergic, but very few actually are truly penicillin allergic, so less than 2%, possibly less than 1%. And by removing that label, we allow a wider choice of antibiotics, often narrower spectrum antibiotics, leading to reduced antimicrobial resistance and less time in hospital. So we're going to be receiving these letters from the hospital where it's important that we amend the coding if patients have been delabelled. And that will be done by the hospital either through taking a history or if certain conditions are met, patients will get a carefully managed challenge of amoxicillin 500 milligrams done in the hospital setting. So not something for us to be doing in primary care, but something to be aware of that will be being rolled out in the hospitals, and just for us to make sure we update the records. Thank you. Thank you for listening.